Yeah, perfect. That actually kind of touches on one of the questions later on. It says, um, where did I find it? What's the difference between using my own cells and a donor's? What are the advantages and the disadvantages? So, this is actually something I wanted to ask you during the panel discussion, but we didn't have time. Is what I struggle with in clinic is why as a patient would I want to do an allogeneic transplant when autos exists? But it's, I think it's a hard concept to understand that, maybe autos are not, like you said, in leukemia. Like, I'll let you answer this question.
Yeah, no, it just depends on the disease. I think allotransplant for, say, something like multiple myeloma, we have good data that shows that there really isn't a lot of benefit in terms of a extending time away from active treatments for myeloma or cures. Um, while it comes with a lot of potential side effects. But for diseases like lymphoma, it can be a backstop for frontline treatments that, if they're not working, at least you can rely on an allo transplant to potentially be a curative option if nothing else is working. So I use this often more when I talk about non-cancerous disorders, but I think of allotransplant as the high risk, high reward option. The likelihood of a cure with allotransplant for a lot of these diseases is very high, but it comes with a risk of graft versus host disease, of higher risk of infections, and in some sense, a little bit of maybe not lifetime monitoring, but certainly much more long-term monitoring for complications than some of these other treatments. And so that's why I think if we think of ourselves as kind of like the back of the line treatment for a lot of things, except for uh, acute myeloid leukemias and MDS, because of the limited number of treatments that we have for those diseases. And then for auto transplants, it's very much, for the diseases it's curative for, we would prefer using that first.
Right. So it's context dependent. It's not just the treatments are effective across all diseases. It really just depends on each disease.